Hey everyone, here to talk to you about post-op recovery kits. This is something that has become very popular in recent years, and with the internet and social media having their space in plastic surgery, the entire industry has been created around people creating these post-op kits. I will say that a lot of the stuff you need post-op should be provided by your surgeon, like your garment and medications should be prescribed, etc. This is more like scar creams, pads, foams, boards, all of those things that people like to use post-op. My advice when it comes to my patients, sometimes they come to me with this $200 package that they found on Instagram or elsewhere, and less is always more. I think sometimes people buy too much in advance, thinking they're going to need so much, and they really don't. A lot of what is provided by your surgeon is going to be enough. And then maybe you need something like an additional pack of poise pads. I always advise my patients to have on hand dark sheets and towels or bedding and linens that they don't really care about to cover up the area where they'll be recovering. Something as cheap as a dollar store shower curtain liner is clutch when you're talking about a high drainage situation. And just making sure that you choose the spot in your home where you're going to recover so that you minimize any damage to potential furnishings, mattresses, and stuff like that. What I hate to see is for my patient to spend $200 to $400 on all of the things and then use none of it. It's not my pockets, but you're already gonna have, for me, you're already gonna have your garment and you're going to have your medications. If you want to add arnica and bromelain supplements, the cheapest place to get them is Amazon, in my experience. I also like a good scar cream, but you don't need that scar cream right away. For me, in my surgery, the dressings that I place stay on for 2 to 4 weeks after surgery, so we can get that scar cream later. Pads. People spend a lot of money on pads. I'm sure you have some linens at home that you don't care for, be it old towels or sheets. And so you don't necessarily need to buy a bunch of puppy pads. You do need some absorption pads, but only for certain procedures. For me, patients waste money when they buy a lot of absorption pads for things like tummy tucks and breast lift or reduction procedures, because those are not high drainage procedures. Remember, I use drains for those procedures, so the drainage is coming out of a bulb and not just leaking through your incisions and everywhere. The high drainage procedures where you're going to need pads and stuff to absorb drainage include liposuction, BBL. That's when you want to invest in maybe a single 20 pack of poise pads, because your drainage really should stop at the 48 to 72 hour mark. If your drainage persists beyond that point, that's something that I want to know about in my practice. The number one underrated thing that people do not prepare for post-op is hydration. And I'm not talking about liquid IV. I'm talking about good old-fashioned water. Having a water bottle that you really enjoy sipping from and having that available to you, having a large capacity water bottle that you really enjoy using. If that involves buying a Stanley cup, then great, make that investment. But hydration is so key and so critical to that early recovery. You just don't want to be in a position where you feel garbage only because you're dehydrated and everything else is fine. My patients are advised to drink at least 2 liters of water every single day to help with the fact that they're losing a lot of fluids by drainage and from sweating and the work of recovery. The other thing that's going to attack and tackle and make unnecessary is constipation. If you are well hydrated and eating the fruits and veggies that I recommend you to eat, then you are unlikely to develop post-operative constipation. Constipation post-op is really common due to the narcotics that we use during the surgery and that we often prescribe post-op for your recovery. So it's not uncommon for patients to call me with bloating and constipation complaints. If it's minor, I say wait it out, have a salad, have some grapes, and some water is usually the early advice. If it's uncomfortable, then I'm going to advise you to do laxatives, something like Miralax, for example. But my first question when you tell me that you're constipated is always going to be, how much water are you drinking? And I promise you, like 8.76 times out of 10, they are underhydrating, and that is why they're constipated. I don't know why people hate water so much. Always choose a part of your home that is not involving stairs. It's not that you're not allowed to do a flight of stairs, maybe once a day at most, but I don't want you going up and down stairs, especially with certain kinds of surgery like a thigh lift and things like that. Even if you're feeling good, it is important to have a rest plan with your recovery. You're not going to be a couch potato. I want you walking every 2 hours, about 15 minutes. If you're drinking as much water as I asked you to, that's going to automatically happen. But we want to make sure that we are not overexerting. Don't put yourself in a position where you tank your recovery because you're doing the most. Also, driving, always plan to have someone handy, not necessarily present 24/7, but someone who is around for the first 7 days who can drive you to your post-op appointment, go to the pharmacy and kind of pick up additional prescriptions for you, and just be your gopher so that you don't have the pressure of having to drive. And also, trying to get into an Uber when you're 2 days out from a tummy tuck sucks. Sorry, I don't recommend that. If you don't have a person who you can rely on in that way, then we do have nursing recovery services, and we'd be happy to refer you to a nurse who has their own rate that they charge for services, anything from just being with you on the day of surgery to being with you for 24 hours or a couple of days, to light house chores, light meal prep. I even had a nurse who was dropping kids off for school. So those are all things that can be worked out with the individual post-op care provider. When it comes to cosmetic surgery, preparation is your best friend and is the key to having smooth and well-managed recovery. So if you follow these tips and do what your surgeon asks you to do, you should be just fine and on your way to enjoying beautiful results. If you have any questions, please feel free to leave them in the comments below. Remember to keep it positive. This is a friendly learning environment, so all negative comments will be deleted. Thank you. Bye.